How do doctors use medical art? In this article, we will cover how doctors use medical art, the benefits of using this as a teaching tool, and what it looks like. Doctors often use medical art to communicate with their patients. For example, when doctors do not have the time or resources to have a full 3D model or imaging of an anatomy they wish to teach from or show to their patient, they can use medical art in order to communicate what they are talking about. This can be done a number of ways, such as in the form of a 2D drawing or a 3D model, but the choice really depends on the patient's needs and what type of information or teaching the doctor feels is appropriate for the situation. It is difficult to communicate complex information in a visual way at times, and medical art can help to do so. This does not necessarily need to be complex or technical in nature. It can simply be a way for the doctor to show the patient with very limited time what they are talking about in terms of anatomy. Benefits of using medical art. Medical art and other forms of art allow doctors to give their patients a greater sense of understanding, as they communicate information in an artistic medium rather than simply through words from a textbook or lecture. Also, by being able to use medical art as a teaching tool for the patient, the doctor is able to visualize what they are explaining in a form that the patient can understand. The benefits of using medical art for doctors are many. It is used to teach patients about anatomy in a direct and visual way rather than just through words. This means that the patient can be more receptive and involved with their history and physical exam as they visually see what is happening as well as understand what is going on. It allows for greater understanding. When a doctor can explain what the anatomy looks like, patients are able to focus on what is being said and what is happening in their body rather than just focusing on trying to understand what the doctor is saying in words alone. It makes memory of anatomy easier for patients and doctors. This is because when the doctor has a 3D model or image of the anatomy, it allows the doctor to draw out what they are talking about while still being able to see what they are talking about. It also helps to make sure that patients understand the correct terminology and have a better understanding of anatomy. More physicians use artwork in their medical education programs, which has helped to advance medical education as a whole. In addition, they are also using other forms of art in their own practice, such as drawing diagrams. Learning about and teaching anatomy is much more efficient when it is done through the use of medical art rather than just by trying to explain through words alone. This is because patients are able to focus on what they are being taught rather than having their minds wander or get distracted when they hear words. What does medical art look like? This is an image that was drawn by a medical artist who is working with a doctor. The doctor wanted to teach a patient about their heart and how the valves work. The medical artist has used this image to help the patient understand what is going on with their heart when they hear the doctor talking about it. It is also great to show patients when they come in for an exam. How to find a medical artist. There are a number of artists that are available, but it is not always easy to find the right one for the job. As with most art and design jobs, you don't have many choices. We recommend asking the doctor or nurse who is working with you if they know any medical artists, as it can be difficult to find one when you need one. Also, we recommend talking to an art school or local community college about classes that teach how to draw and use medical art. This can be a good way to find a medical artist without having to rely on someone who you already know. Medical artists and what they do. A medical artist is an artist who works with doctors and healthcare providers in order to teach anatomy to their patients in an effective way. This kind of art dates back thousands of years and is still used today to enhance learning about anatomy, develop teaching methods, and other uses that benefit the patients and physicians. Many medical artists have also created their own medical art schools as well. Medical artists can work with a variety of media, including drawings, 3D models, and sculptures. In order to become a medical artist, you should go to an art school that has classes specifically related to teaching how to use medical art. You do not always need to become a full-time artist in order to be hired as a medical artist, as many of them have other full-time jobs.